I can just see the room filling up a bit now. So yeah, let's make a start. So good afternoon, everyone, and thank you all for joining us for this community energy efficiency training session with Northern Powergrid and Groundwork's Green Doctors. Thank you all for joining us, and it's really great that we've been supported by Northern Powergrid to put this session on as part of our community energy support work that we've been doing with them here at Regen for the past year or so. And this is an extension to that program. It's an area that a lot of you have told us you're keen to hear about, and we're really pleased to be covering this area today, because energy efficiency is a really key area if we're to achieve net zero, and it's something I know Northern Powergrid have been looking at more. It's something that Groundwork have worked on for a number of years, and it's something that communities across the UK are taking an active role in energy efficiency projects, in supporting people in fuel poverty and doing energy advice work in their community. And what we want to do today is really to give you guys, along with Green Doctors, the practical tips, the advice and the information, so you can go out into your community and deliver this type of work to support net zero in your community. As I mentioned, we do have a lot to get through today, and we have quite a few people on the call, so I would encourage everyone to just introduce yourselves, say where you're calling in from in the chat function. But before we get started, I will just ask the Regen team, Northern Powergrid and Groundwork, to introduce themselves quickly. So I'll pass to Anda first of all.
Thank you. Good afternoon. Such a pleasure to see you all here in such great numbers. My name is Anda Baumette. I'm Community Energy Lead at Northern Powergrid, and I work in the policy development, kind of wider decarbonisation team. Thank you.
Thanks, Anda. Simon.
Hello, good afternoon, everybody. Great to see so many people. I'm Simon Kilshaw. I work for Groundwork Yorkshire, and I'm the manager of the Green Doctor service.
Thanks, Simon. Do we have Alan?
Hiya, I'm Alan Spall. I'm Green Doctor Advisor, work for Groundwork Yorkshire. Nice to see everyone.
Thanks, Alan. Zach?
Hello, Zach Harris. Glad to see everyone here. I am a Green Doctor with Groundwork Yorkshire. I'm also a domestic energy assessor and retrofit assessor as well. Thank you.
Thanks very much, Zach. Jodie.
Hi everyone, I'm Jodie. I lead our community and local energy programme at Regen, and yeah, it's great to see you all. Thanks for joining us.
Thanks, Jodie. Prina.
Hiya, I'm Prina. I'm part of the communities team at Regen. It's nice to see everyone here.
Great, thanks, Prina. We do have a few more of the Northern Powergrid team who are joining us in listening mode today, and may choose to introduce themselves in the breakout sessions that we've got a little bit later as well. Okay, just to run through some quick housekeeping. I'm sure a lot of you have joined our sessions with Northern Powergrid in the past, and I'm sure we're all more than used to Zoom calls now. But just a reminder, stay muted unless you're speaking to help us with background noise. Do feel free to use the raise hand function, or physically put your hand up to try and get my attention as we're going through. Feel free to ask questions in the chat function. We do have a packed agenda, so it'd be great if you all make use and use that as to be interactive today. As I did mention in my email, we will be recording the session for ours and Northern Powergrid's internal use. And a bit later on, we will be using polls to get your feedback. So this session is a result of the feedback that you guys have given us, and that's really helpful to us to know what sort of sessions we can put on to support community energy across Northern Powergrid region. So please do give us your feedback in those polls and throughout the session as well. Prina, can we just flash the agenda up, please? Great, thanks. So yeah, as I mentioned, we have a busy 2.5 hours this afternoon with a lot to get through, and yeah, we've got Groundwork's Green Doctors experts to really sort of lead that training in the middle of this session to give you the practical tips that you need. So yeah, we've got a lot to get through. I'm going to start just with a quick overview of some of the energy efficiency projects that we've seen in Regen's work from around the country. And that's just a flavour of some of the different types of projects the communities across the UK are doing in this area. Really, just not an exhaustive list, just a sort of a brief introduction to give you an idea. We'll then pass over to Groundwork and Simon, the Green Doctors manager, to give an introduction to the energy advice work that they do, and to give you tips on how you can start similar projects yourself. So yeah, what partners to look out for, how to identify who needs help in your community, how to do community engagement, and where to look for funding, things like that. So it's really sort of practical tips for all of you. Then we've got Alan and Zach, who are also in the Green Doctors team, to go over the fuel poverty alleviation and energy efficiency measures that they carry out and that you can carry out as well. And they're going to give some top tips and places to look for that sort of thing. Now we do have 2.5 hours, and we're going to give you all a tea break in the middle of that, just to give you all a chance to get a refreshment, stretch your legs, and have a minute away from screens. And then we're going to come back and we're going to have some breakout sessions. And they're really our chance for all of you to ask the questions that you want to ask. In each of those breakout sessions, we'll have some of the Regen team, some of the Groundwork team, and Northern Powergrid as well in each of those sessions, to ask you the questions and to get you thinking about what your actions are going to be following this training session. What you're going to do to carry out this work in your community. We'll then come back and we'll have a sort of feedback from that session, and give you another chance to ask any questions that you've not been able to so far. And then what we really want to do is get your feedback and hear about what all of you want us Northern Powergrid, Groundwork to deliver moving forward. And we were quite interested to know if this training session has made you eager to go out and just learn more about this area. So yeah, that's our agenda, and I think we will move on to our first brief session, which is our overview of community-led energy efficiency projects. So what I'm going to do here is just spend about 10 or 15 minutes, just give it, like I said, giving a flavour of some of these projects that we've seen. Now, Regen, we're a not-for-profit centre of renewable energy expertise. And we, as part of that, we're a mission-led organisation to look into decarbonise, decentralise and democratise the energy system. And as part of that, for about 8 years now, we've run a programme of community energy support, working with community energy organisations from across the UK to explore different projects, different business models, different ways they can lead on decarbonising their community. And energy efficiency is a key part of that. So we could just move on to the next slide, please, Prina. So briefly, what is energy efficiency? What do we mean by that? Essentially, the very sort of basics of it is using less energy to perform the same task. And in the energy sector, what that means in practice a lot of the time, especially relating to some of the things we'll be talking about, is that energy to heat our homes. And it's important because it's a critical enabler of net zero, whatever the pathway. And I think we say whatever the pathway at the moment, and that's because for a while we've been waiting for the heat and building strategy to come out from the government to give us some sort of UK-wide, I guess, pointers and lead on what the pathway to decarbonising our homes and buildings might be in the UK, whether that will be electrification in some places, with everyone getting heat pumps, whether that'll be using the gas network for hydrogen, or whether that'll be local heat networks. Whichever of those solutions that is done in each sort of place around the UK, energy efficiency has to be a part of that. So that's why it can enable all of those things, and it's what we would call a no regrets option. So based on work that Regen's done as part of our sort of research into this area, we think that up to 60% of homes in the UK require significant energy efficiency improvements to achieve just a 20% reduction in energy demand, which will obviously help us to decarbonise. And we found as well, based on our work, that could be up to 98% of houses could use some sort of energy efficiency measures, whether that's just small things. So as you can see from this slide, what we have at the moment is low building standards, an aging building stock. We have cheap and convenient heat from the gas network, and that's married to high levels of fuel poverty and low levels of well-being. So what we don't want to see is cheap gas being replaced in places by electric heating, which is more expensive, because that would just exacerbate fuel poverty. What we would like to see is more energy efficiency as part of that. So that at the moment we've got high carbon emissions, but for net zero, what we need is higher building standards, an improved building fabric, affordable, convenient, low carbon heat, which is obviously really important to eradicate fuel poverty. And yeah, energy efficiency, it can lead to all these sort of different societal benefits, as you can see in that chart just there. So it's not just energy savings, as we might sort of think at first, but it's also to do with well-being, to do with energy security, fuel poverty alleviation, lower air pollution, lower emissions, lower energy prices. Yeah, it has all these sorts of benefits as well, which are often uncaptured, but is really necessary if we are to achieve a just transition and net zero in the fairest and most inclusive way possible. We could just have the next slide, please, Brina. So what's the role of community energy in this? Well, as we know, a lot of people aren't terribly engaged with energy, don't understand the complexity of the system, and often don't trust the big energy companies. So community energy in looking into this, in the things that'll have to be done to people's homes, it has a vital role in providing that impartial support and advice, and reaching the hard to reach and vulnerable, which I know the Green Doctors guys are going to sort of talk about a lot more later. And the projects that community energy organisations across the UK are doing is energy advice, so that can include home visits and help with tackling damp and drafts and things like that. Energy efficiency measures, so that can be small measures, that can be draft proofing, that can be advice on accessing grants, that can be also help supporting people to sign up to the priority services membership, which Northern Powergrid run to support vulnerable customers. So that can be part of that advice service as well. That goes sort of hand in hand with fuel poverty alleviation. So those home visits, it's picking up on the causes of fuel poverty and supporting people with the sort of outcomes of that and what might be the reason behind it. And then as we're looking towards net zero as well, more and more community energy organisations are taking on whole house retrofit projects, which are obviously more expensive, more sort of costly and more complex than simple measures. But that is something that more communities are starting to look into as we think about how we might make our existing houses suitable for net zero. So what I want to do through now is just run really quickly through some brief examples of good case studies that we've seen from across the UK in different areas of energy efficiency work. So could we just have the next slide, please, Prina? Thanks. So from what we've seen, one of the biggest sort of community energy-based energy advice services in the country is run by Plymouth Energy Community down in Devon. And as you can see by the numbers there, it's they have a full-time team of paid staff carrying out these home visits and really have an excellent reach across Plymouth. They do home energy advice visits. They publish guides and resources on their website. They give advice on switching suppliers. They carry out simple energy efficiency measures. They support people to sign up to the Priority Service Register. And they partner as well with Plymouth City Council as well to carry out this work and do those referrals. And it's funded as well as the partnerships with the local authority through lottery funding and other grants, as well as a little bit of income from their renewables projects as well. So yeah, really good sort of example for anyone looking to do I guess sort of large scale energy advice in the community. Can we just move on to the next one? So a really interesting case study that we've known about for a number of years is Southern Staffordshire Community Energy. And they've partnered in quite a new innovative way for community energy. Something that we'd not seen a lot of was they partnered with the North Midlands NHS Trust and the charity Beat the Cold to basically intervene and stop the cycle of hospital readmissions from people who are suffering conditions that are exacerbated by fuel poverty. So by using the income from solar panels that they'd installed on hospital roofs, they used that to carry out home energy advice visits targeted at patients who've been discharged from hospital and supporting them to stop that cycle of readmission into hospital from, for example, breathing difficulties and sort of ailments like that. And that project was funded by local investors as well as the surplus from their renewables projects. And then another community energy organisation, one of the more advanced ones that's began over the past few years to look into whole house retrofit. And that's Carbon Co-op's People Powered Retrofit project, which they run in Greater Manchester. That's an end-to-end retrofit service. So from the very beginning, the first things that you get done right to the end of the retrofit, they provide a service. And they wanted to do this to take a community energy approach and a sort of resident-centric approach to tackle the barriers that homeowners face. So this is for the able to pay market. This is originally focused at, but overcoming the barriers that they saw as a lack of suitable contractors to carry out this work and concerns around the quality of works. So they sort of run workshops to explain to people what sort of service they'll be offering, what they'll be doing in people's homes, and they take that real sort of people-centered approach. And that's a localized community approach to creating a market for energy efficiency and whole house retrofit. And they've been able to do that with government and EU funding as well. So yeah, they're just a few examples that we've seen of what we think are really good, energy efficiency community-led projects. By no means an exhaustive list, and as I'm sure that Simon and the other guys will touch on later, this area can seem quite daunting and it can seem quite a lot to do, but it's not necessary to carry out whole house retrofit projects or to do all of this. It's perfectly, you can start small or aim as big as you want with your projects. There's lots of different examples out there. So just before I hand over to Simon, if there are any burning questions, we do have a minute. But if not, I will hand straight over to Simon.
That's great. Thanks, Kai. Thank you, Brina. And I'll just start straight into the presentation. If you could go to slide 1, thank you. So yeah, welcome everybody. Like I say, it's great to see so many people here and with such an important and urgent issue. I'm Sam Kilshaw, so I work for the environmental charity Groundwork. Here's a little bit of a brief history of Groundwork. Groundwork is a national organisation founded in 1982, and we have regional hubs across the country in Northwest, Northeast, Midlands, Yorkshire. And we run a variety of different community-focused action projects, improving green spaces through our landscape and architects team. We help people get people back into work, create green jobs. There's a variety of things that Groundwork do. One of the major programs within Groundwork is the Green Doctor program, which it was founded in 2006, and ourselves in Yorkshire have been running the Green Doctor program for around 13 years now. So we've been asked by Northern Powergrid and Regen to give a training session on fuel poverty. And as Kai was outlining there, the issues surrounding fuel poverty are multiple and complex. And the purpose of this particular, it's quite difficult to know how to pitch a training session on fuel poverty, even though we give many other training sessions to frontline workers and community groups. We haven't done this particular type of training session before, which is how to give advice for people setting up their own energy advice program. So the scale of that could be from just one person in a local community to an operation like, well, we're seen with Plymouth Energy or ourselves, where we're a team of 10 covering quite a wide geographical area. But hopefully this session will be useful for people on all different levels and different stages. So the aim of the Green Doctor program, so that's the aim of reducing fuel poverty or energy vulnerability. It's the same kind of term, but covers the actual meaning of people in desperate situations, really struggling to pay for their energy, often struggling to pay for other bills and food as well. And the result of fuel poverty is ultimately, disastrously, excess winter deaths. So the aim of the Green Dots is to try and prevent those excess winter deaths. Only a few years ago, the number of excess winter deaths was over 50,000. That's the period from November to March across the country, which is huge and quite staggering, really. The Green Doctors are helping to increase energy efficiency. We do that for a variety of means through the small measures, which we'll come to later. And also through like retrofit programs and behavioural change advice as well. In doing so, trying to help people cut their costs, increase energy efficiency, that has the hopeful effect of promoting health and well-being, particularly amongst the most vulnerable members of society. One of the great things that we do try to do is to enable people to promote independent living. One of the most successful outcome of a Green Doctor intervention would be the actual passing on or the imparting of information, enabling people to take control of their own situations, their own energy costs, and become more independent in doing so. So that's one of our major aims, and providing extra support. One of the many issues that we come across in relating to fuel poverty requires more of a holistic kind of view to its approach. So whilst we'll go there with a remit of energy advice, we're also looking at many other types of issues as well, and providing extra support and referring on to other partners for that support. Next slide, please, Brina. Okay, we just come on to touch, well, what is energy advice? How would you describe that? Our projects, we're trying to have a synthesis between energy efficiency, decarbonisation agendas. I'm trying to synthesize that with fuel poverty reduction strategies. The just transition, as Kai mentioned earlier, is a huge important factor in our work. When you're looking at fuel poverty, the primary reason for people's engaging with the service, it can often be not energy efficiency. That might not be the most immediate priority at the top of the list, unless you equate energy efficiency with improving your income and reducing your energy costs. So people on low income, maximising their income is often the main trigger for contacting services like ourselves. So we're trying to reduce fuel consumption. That's through a variety of means, through energy efficiency, reducing the costs through appropriate energy tariffs, supplying information where people can do comparisons for themselves, installing some of those small, simple measures like LED light bulbs, draft proofing, reflective radiator panels, chimney balloons, a variety of small measures in which we can install and offer. Energy advice is, like I mentioned earlier, is a great deal of enabling somebody. So education, some of the things that you may seem quite obvious to somebody who's been in the energy advice sector for a number of years, maybe a completely new thing for somebody, and they may not know for something like the Priority Services Register and they can get extra support, or for the Warm Homes discount, they can get a grant from their energy bills. So just imparting whatever information is going to be useful. Encouraging behaviour change, that's sharing information, I'd like to say on that one really, because that requires a tailored approach depending on people's circumstances. Signposting, I mentioned earlier, that's a very important aspect of the work that we do, working across partnerships in relevant sectors and signposting for those complex issues when they inevitably do arise. Improving health and well-being, and water advice. So whilst this is fuel poverty and would seem directly related to energy, water and energy are very closely interlinked, and whilst we're giving energy advice, we're also giving quite a raft of support and advice tailored around water as well. Thank you. Next slide, please, Brina. Okay, so how to start? So you have your locale, and you'd like to give some energy advice to your community. You may know the needs of your community already. You may know where those areas of hotspots are, or those levels of deprivation, or it's in a rural community perhaps, and you see some gaps where people are struggling. That's good having local knowledge, of course. One of the great tools that we use is the index of multiple deprivation. So if we're working across perhaps new regions where there's a gap highlighted and the severe deprivation, high levels of fuel poverty, we may look on the index of multiple deprivation, which is an indices which measures relative levels of deprivation across the country. So you can really target where the hotspots are and focus your activities. Very useful. If you're going to start an energy advice project, are there any existing schemes in your region? So like I mentioned earlier, we have Green Doctor programs across the country. Kai mentioned earlier on one of the slides, we've got the local energy advice program, LEAP, they're national. Citizens Advice, increasing their energy advice services across the country in the last number of years. Has of Age UK. So you don't want to repeat something that's perhaps already in place, or perhaps that you can partner with somebody or link up with one of the existing services. So just scope out what's in your area to start off with, really. What are the partnerships in the relevant sectors within your area? One of the most important ones relating to fuel poverty is the housing sector. We've got the housing officers, housing repairs teams, neighbourhood community teams, all coming under housing. Health, covering a wide variety of social prescribers, social care, specialised teams within health, which are related to like excess winter deaths, like cardiovascular, respiratory teams, mental health teams. Debt advice, certainly one of the most relevant sectors when you're dealing with issues with fuel poverty. Can you partner with some, like Citizens Advice, for example, or another local advice, debt advice organisation? Perhaps there's welfare support in your area. You could partner with where people come for extra support for certain welfare needs, energy being one of those. Perhaps you can partner with those. Looking at the local council, so many local councils, not all, will have what they call a statement of intent. That's the from where they may have funding from the energy company obligation, the eco schemes. A council will often produce or publish a statement of intent on their website. It's good to check your local government. There's the links here, and these slides will be shared with the group later. With the links here. So it's good to check what's in your local authority, what's the existing schemes, can you fit in there, can you link up? Funding, so you obviously you need funding to start your program, and to approach the funders, and I'll come on to a slide a little bit later where there's some examples of funding opportunities. You need a project plan to present to the funder. So that plan may include, or should include, some of these things. So your target group, are you looking to target a particular group or a particular area? Perhaps it's elderly or a rural group. Perhaps a very niche locale in a certain postcode. So have a clear understanding of what group or area you're trying to target. What type of eligibility criteria will you set for your program, if you have one at all? There's a danger if you have no eligibility criteria, you may be inundated by so many referrals you can't handle them. What the threshold is for the income for that criteria, what the different health aspects are for the criteria, all needs to be thought about. The timescale of your project, is it 1 year, is it 2 years? What are the outputs that you're looking to achieve? Again, I'll come on to another slide with some typical type of outputs. The monitoring of your project, how well or not is that progressing through the time? What kind of partners are you bringing in to work with, if any? I would say a funding bid would be more successful if you're more inclusive and offering a holistic service with the partners involved. And very importantly, feedback from the clients, from the people that you're helping to support. What's their experience of your service, and how can you improve? Next slide, please. Okay, so we come on to funding and collaboration. So these are some examples of our Green Dot service in Yorkshire and the types of funding that we get. So local councils, I mentioned, there's the possibility that they have a statement of intent or an affordable warmth plan in your area, and they may be really happy that you want to engage with them. The example we have here in Leeds, we're based in Morley in Leeds, the Home Plus service, funded by the local council and the public health combined, and the clinical commissioning groups. That's a collaboration between ourselves, Care and Repair, and Age UK. Similar in Bradford, we have funding from the council and public health for the Warm Mums Healthy People partnership. And that's likewise, that's a partnership, small partnership of 5 groups, again, including Age UK, social prescriber, in churches, and a death advice organisation. So we've got our specialised services who are given a holistic service. One person presents themselves to the service, and there's the opportunity to get support from a wide range of issues. Funding so we're here, funded by Northern Powergrid, and we were very fortunate to have funding from both Northern Powergrid, Northern Gas, Cadent and Yorkshire Water coming under the district network operator opportunity. There's a link here for the Northern Powergrid Community Energy Fund, who are keen to receive ideas for energy advice and other related project ideas. The last couple of years, we've seen Energy Redress Scheme, this administered by Ofgem. So you've seen charities like ourselves and other social groups who have been able to apply for funds for energy advice projects. So the funding comes from where energy suppliers have fallen foul of rules and regulations. They have to put money into pay penalties and put them into the Ofgem pot. That money is then distributed across a variety of schemes through the energy redress process. There's different rounds going on all the time. Again, have a look at the website. The next round, maybe you could put a bid in for that. They also have the energy redress fuel vouchers as well, which we've also taken part in, as well as many of our partner organisations. So have a look at that. British Gas Energy Trust Scheme, they have funding for a variety of different areas. We're funded in Hull. We have been before in Bradford. More than interested and keen to listen to any project ideas. But as Kai was mentioning before about retrofit projects, larger EPC work, depending on your type of organisation, what the scale of operation is going to be, there's potential there for further funding. Then you've got the installation aftercare. What I mean by that is where you've got installations of, say, for example, a first-time central heating system, which has been perhaps a conversion from electric only property to ground source heat pump. And it's just that that hand holding, that aftercare after the installation of how to use the new system, being aware of any issues that maybe crop up or arise, any other energy efficiency measures. So local energy advice program, I mentioned that, an opportunity for funding. And then you go to the like kind of niche funding opportunities. Smart Energy GB often have rounds of funding for raising awareness to particular target groups for the take up of smart meters. Citizens Advice, the Big Energy Saving Network, similar, raising awareness about the possibilities of switching, going on to the PSR, Warm Homes Discount, other grants and savings, and energy efficiency advice. And then you've got a variety of other possibilities of funding, depending on the scale of your project. The point is here with these last four is that you can be so diverse as an energy advice service, is that you can branch off and diverse into other climate action initiatives or funds, electrical safety, debt advice, and other programs like Hopeful Families. Next slide, please. Some of this may seem a little obvious, some may not, but obviously considerations of administration. You've got your project idea, you've identified some funders. What kinds of documents and processes do you need to go through? So insurance, your public employer liability insurance, your vehicle insurance, if you're going to be doing perhaps home visits in a radius, depending if it's an hour's drive away, how cost effective is that? So having a vehicle, driving licenses, knowing your legal responsibilities, having informed consent from people that you're trying to give support to. Knowing legal responsibilities when you're installing measures in certain properties, say for example in the privately rented sector, can you draft proof there without the consent of the landlord? You need to know these things before you act. You work with vulnerable people. If you yourself having a DBS, ID badges, we have an enhanced DBS checks for all our Green Doctor team because, like I say, we are working with vulnerable people. Bank accounts, yeah, that's quite obvious. You're ordering materials and so on. If you have employees, clear job descriptions and well-defined responsibilities. I mentioned vehicles. If you're doing small measures, can you store them? Can you store them over time? Can you store them safely? If you've got equipment and tools, what kind of equipment and tools will you need? Things like loan working procedures, depends on which type of area you work in. Green Doctors often work in city, urban areas. Late at night, you don't really know until you actually get into the home or deal with the people who you're dealing with and where you're going. So having loan working procedures is vital. And having those emergency contacts, particularly like for safeguarding issues. Training programs, what kind of training programs are you going to look at? I'll have a slide later on where I'll just go into that in a little bit more depth. IT system, how do you record the information that you collect once you've defined what information you are collecting? If you're doing home visits, you've got a centrally stored system, IT system for information. When you're doing home visits, what kind of device will your team be using or yourself? We use iPads for all the team, and that's how they sit down and go through the assessment for each household. How do you store that information? Is it stored safely, safely, and is it compliant with GDPR? Next slide, please. Okay, now we come on to the actual delivery. So again, establishing what are the goals, clear aim for the project, what you're looking to achieve, and making sure that aligns with the objective of the funders and how you're going about meeting the needs of those funders. Some of the things are quite easy to prove and to evidence. You've got more tangible kind of outcomes, things like financial savings, how much you've saved from the switch, or perhaps from the Warm Homes discount, or some of the debts advice support you've given. How much CO2 you've saved, what's the saving financial in the CO2 from the measures installed, number of measures installed. Those are tangible things which you can black and white easily code. Other things are less so, less tangible. So things like have you relieved how much have you relieved the stress? How much has has there been any improvements in health and well-being, or levels of thermal comfort, or perceived levels of happiness from your intervention? Some of our programs, they have these features built into them already. So you have a baseline where you could collect information from what you call maybe health and well-being aspects or social value aspect at one point, and then you follow up with a follow-up call later on, maybe 2 or 3 months later after the intervention, to see what those perceived levels of changes are. And that's why that little diagram is there in the corner. Thinking in delivery, what difficulties may you encounter? You've got the funding, you have a project, but there's lack of interest. Suspicion, perhaps, nothing's for free in some cases. How do you go about stirring that interest? And I'll come a little bit in the next slide in methods of engagement. Perhaps there's too much interest. It could be winter time and you've done a fantastic job of raising awareness and you've got hundreds of referrals coming in. How do you manage those expectations? Seasonal variations, looking at fuel poverty. Clearly there's a spike in excess winter deaths and urgent cases and complex cases through the winter period. And then you've got through the warmer months. How do you cope if you have a team with those seasonal variations? How do you keep people busy for that period of time? Continual funding. So you've perhaps had a great year with your community energy advice project. You built up a reputation, you've got great interest. How is that funding continued? That's one of the great aspects of the funding we have with the district network operators. That's been long term, so you're able to establish yourself within a community and build up a reputation. Referrals, what is the referral process? How do you establish that process? Referrals, you're receiving referrals by email. Do you have an online referral form? Are you able to accept phone referrals or via post? What information do you need from the referrer? And that information may contain sensitive information. It certainly contain basic identification information, but maybe other risks involved. So you need to make sure that compliant with GDPR. I put here, I'm going to stress this throughout the presentation, making every contact count. You may only get one opportunity to perhaps engage with this person, and that's why it's so important to have a wide support network of partners, and to have the theory when you're going into a consultation or a home visit that you're going to try and make every contact count. So you're going to make the most of that visit or that intervention in some way. You can help with your remit, perhaps you can help in other ways, and it's just recognizing that and drawing that information out. Duty of care, there may be issues, there will be issues, absolutely, when which are coming outside of your remit of energy. So safeguarding, duty of care, you may be the first one who's recognised a safeguarding concern perhaps, or it could be a variety of things. Duty of care is really important, and I've mentioned before signposting for extra support for those other vital complex issues. Next slide, please. Okay, so it's often I've known from the experience, I've been working with Groundwork for the last 6 years and been managing for the last 4 years, and we've received funding for a variety of different projects, and that's great. But then there's no referrals coming in because nobody knows about it. So how do you go about that? And the different methods of engagement here. Here's a few. It looks quite extensive, but there are others. Looking for ready-made groups, so church groups, faith groups, groups that attend community centres. Can you work with those types of groups? Can you become established perhaps in one of the hubs with a drop-in session, speaking to people directly when we do get the chance to have face-to-face and live events? Food banks, obviously people struggling with energy or struggling with food, obviously interrelated. Can you have a stall there and be there and chat to people? Can you put some of your flyers, if you're doing some kind of hard copy paper marketing, in with the food parcels, let people know about your service? Attending focus groups, that's again drawing together, synthesizing fuel poverty and perhaps climate change, net zero, decarbonisation. We have some voluntary community enterprise groups here today, sitting at the table and talking with those groups, letting people know how you can be involved. Public engagement events, we've seen a lack of those recently, but a great way to get the message out. Just be there, having your presence known, particularly in the summer period when you've got fairs, local things going on. It's nice to know your local community through that way. Paper marketing I've mentioned, having posters, flyers, leaflet drops in targeted areas. Online, we've seen such a huge increase in the use of online for methods of engagement, particularly since lockdown, a variety of social media methods, webinars and so on. Traditional media, this is becoming more and more prevalent and important, especially in the digital excluded group or people offline. They may prefer to listen to the radio, they may watch TV, they may see your adverts in the newspaper or in a newsletter. So you can have interviews on TV, radio. Some are more than welcome to have a fuel poverty slot. Door knocking or leafleting in targeted areas, mentioned that. Building up your relationships with local authorities, trying to dovetail into existing schemes that a local authority may be running in a certain area, maybe upgrading some kind of heating systems in the area, and they're looking for that little aftercare, after touch after the heating system, maybe all too welcome to have your advice on board. Other sector partnerships that may be relevant, could be a money advice team in a housing association, or a particular, say, a cardiovascular team in a health situation. You may be able to join the team meeting for just have a chat, 10-15 minutes with their particular specialised team and let them know about your service, what you can offer and how you can work together. Similar with the social prescribers. Green Doctor, the name is kind of gives it away in some ways. We've seen over the years of how much more we've become more of a social prescribing organisation as much as an energy advice organisation. Certainly in the last year or so, with the number of people who are struggling with low incomes and a variety of other complex cases. But in the last few years, since austerity has perhaps cut some of the more statutory frontline services, we've seen our role really increase on that side. How you can build in with those other social prescribing organisations. Really importantly, word of mouth. If you're doing a good job, your reputation will get widely known very quickly. We've seen that, particularly when you've got close-knit communities. People speak to the neighbour, or have you heard about the Green Doctor or another equivalent energy advice worker? Yeah, that stands you in great stead. One of the most important ways in which we've found of methods of engagement, networking, is through our advice and training programs. So offering advice to general public, community groups, specialist groups, as I've mentioned, and frontline worker groups. You can really get the message across there and build up those really important partnerships. Yeah. Next slide, please. Okay, so just come on to training, what kind of training you may consider. I certainly would go more than considering the first one, and I'd say it was actually absolutely compulsory, necessary. The NEA Level 3 Energy Assessor Training course, City and Guilds qualification. All our team go through this as just a part of the process of induction. So do other equipment organisations. They go through this NEA Level 3 course, so that's certainly a good starting point. Then if you want to move on from there, then you've got, like ourselves, you have a more in-depth look at fuel poverty. The NEA also run a variety of other courses as well, so I must mention that, some other specialised courses. Things that our team have extra training, so you've got mental health first aid. Absolutely, we're dealing with people who often have perhaps a mental health condition, and it's just recognizing some of those things, how to work with those people, how to be more empathic, how to get the message across. Vital. Basic hand tools training, if you're installing small measures, how to do it safely, what kind of new tools you need. It's sad to say, but we've come across quite a number of cases, and that's why the team are training suicide awareness, fuel poverty and the complex issues that are interrelated, often cause people to be in desperate situations. And, you know, we have calls where we've had to, you know, call an ambulance, call the police. It's a safeguarding issue. I mentioned before about lone working, have lone working training for either yourself or your team. Have robust procedures, have devices, perhaps. We have devices on our phones which alert people when we're alone working situations. First aid course, you never know what's going to happen. You're working with tools, you're working in homes, could be an accident, vital you have first aid training. Domestic energy assessor, so as Zach mentioned earlier, he's DEA trained. This is kind of like moving on from your energy advice, but still absolutely vital to give that more in-depth look into like thermal efficiency of buildings, which is so interrelated into fuel poverty. And again, the making every contact count. All the team have making every contact count. Other courses, hoarding awareness, fault prevention, closely related to cold homes, number of trips and falls, people being admitted to hospital, and domestic violence. Next slide, please. Okay, yeah, signposting. So we're going in there and we're trying to help somebody perhaps save some money on their energy tariff, and install a few light bulbs and do what you call a general kind of energy advice visit. And then you run into many more complex issues. So that's why signposting is a really important part of the service. It makes that holistic element, just joins the dots. And again, reinforcing that making every contact count. So looking to signpost to these some national organisations for debt advice, step change, national debt line, citizen advice, energy trust applications. That's where people may have high levels of energy debt and another debt. They can apply for trust funds. You signpost there. Mental health services. Again, vital that you know those important links for signposting. The energy company obligation scheme. People may want to access boiler replacements, insulation measures, first-time central heating, cavity wall. How do you access those schemes? Food banks. Could you become a partner in the Trussell Trust and give out food bank vouchers at the time of your visit or the time of your call? You do paper versions, you can do electronic versions, link it into the food aid network. Signposting to local fire and rescue service. Which we have great links with in West Yorkshire and North Yorkshire with for their safe and well visits. So they're quite all-encompassing visits. So it's not just looking for smoke alarms, it's looking for many other things as well, electrical safety, a variety of other things in the home. And then you've got other niche things like heater amnesty. It's a project we're working on for people who may be not using the central heating system, relying on a portable heater. They may have a dangerous appliance and they can change that appliance for a new one. People lacking just basic white goods, no cookers, no fridge, no washing machine. How to access some of those grants for those white goods, that's vital to know. And signposting into your local authority for housing officers, repairs teams, sustainability teams. Yeah, signposting a vital part of the service. Next slide, please, Brina. So I mentioned earlier at the beginning outputs. So you've got your project plan, what kind of outputs you're looking for, and this is just some of the examples of the outputs and support that our Green Doctor team gave in the year from the 1st of April to the 31st of March 2021. So during the pandemic, basically. So from just over 2,100 consultations, these are the kind of things that we're helping people with. So obviously switching tariff supplier, you can save huge amounts of money for households. Warm homes discount, knowing when the scheme is open is vital, and when it closes. Some schemes close earlier than others. Outputs, boilers replacements, first time central heating, installation measures. Mention the priority services register, putting people on the register for extra support services. Energy, water, other debt, that's something that you're looking out for as well in the outputs. Smart meter advice, trust fund applications for those high levels of debt. I mentioned earlier about water support, so you can save a huge amount of money for people who are in water poverty, are vulnerable, water vulnerable. Accessing social water tariffs like water support, water shore, advising correctly on water meters, working what their average use is, could be a benefit from a water meter, helping people in water debt. Then we've got other things like the outputs for the voucher scheme I mentioned earlier, helping people with immediate help with a fuel top-up voucher. But more importantly, it gives you that chance to engage with that person. It's not just giving the voucher and giving some money and then saying goodbye. You have that opportunity to engage with a really vulnerable person and try and get to the bottom of what that deeper issue is in some way, if you can. Welfare support payments, that's just highlighting a partnership we had with the Leeds Welfare Support Scheme, help people again with emergency fuel top-ups, and the number of fuel vouchers and food parcels. These are just some of the outputs and types of support that we can give. And what you would notice there, hopefully, is that none of that includes the energy efficiency measures, of which we have the photo there of Rachel, who's one of our green doctors, who's installed a light bulb there successfully. But this is an example of what you can do actually via telephone, which is substantial. And that's apart from the thousands of LEDs, reflective panels, draft proofing, and other small measures that we can install on home visits. Okay, next slide, please, Pina. Right, I think there was one just before that, actually. Yeah. So it was at this point where we was having a natural break, and perhaps if there's any questions at this time before we move on.
Yeah, thanks, Simon. Some really useful tips and pointers there, and yeah, hopefully helping people to start thinking about how they might start these projects and good places to look for more information there. But yeah, as Simon mentioned, were there any questions anyone have for Simon? Anything in there people want to clarify in just before we move on to Alan and Zach? Robert, yeah, I can see you got your hands up.
The grants for capital work.
Sorry, Robert, I didn't hear that.
Are there any grants for capital work?
What kind of examples would you give?
Solar panels on roof, insulation, heat pumps.
Yeah, these are the kinds of things that we would become more involved in through the retrofit programs. So Zach is a retrofit assessor, coordinator, and we have other members of the team. I think when you kind of diversify from an energy advised project, then you become more involved in those larger capital works as part of that process. So some of the housing association larger capital programs where they have in retrofit schemes, then we can become more involved in those.
Just mention as well that there is, with the target of being net zero, there is going to have to be continual funding. So the Green Homes grant was running last year, obviously not that successfully, but if they are going to want to achieve their targets, then continual funding will have to become available for the measures you're asking about, Robert. So such as the heat pumps, solar PV, and that's where the local authority statement of intent would be the starting point for that. So that's on a hyperlink in the slide that we can share after. It'll describe what's happening in your area right now, and then what will hopefully be happening in the future, and that will continually be updated. It's very hard to put specifics on because there's people from all over the country here. I would look at your local region first and then work up from that.
Great, thanks Zach and Simon. Yeah, were there any other questions at this point? No, okay, I think we will hand over to, is it Alan next? If we could just get those slides back up, Prina.
Yeah. Do you want me to give a little summary, Alan, for this before we start?
Yes, please, Simon.
Yeah, we just included this slide. We thought it'd be a good idea of what vulnerability looks like. So this was a case that myself and a colleague went to a couple of years ago, and we will share the slides later, and there is some more detailed information of this particular case. But I just want to outline really some of the incredible conditions that we encounter that people have to live in. So this gentleman, aged around 60 years old, living in a quite a wealthy area of North Leeds, Otley, and we were referred, he came to our notice from a police community support officer who we have links with them. They do refer into our schemes, who noticed that the state of the house from the outside was dilapidated. Children were playing in the unkept garden and throwing stones and so on, and that's how this person came to be identified and to engage with our service. Just looking inside the house, this person is socially isolated, no heating at all. The only running water in the house was from almost a dripping tap from the cellar. And if we see the picture on the right hand side where the kitchen sink is, there's lots of bottles around there. He was filling bottles up, the old disinfectant bottles with water, which he'd use around the house. Couldn't bathe in the house because there's no bath. The toilet was absolutely atrocious. All the windows, you can see on the first picture on the left there, have been taped and sealed. And this, alongside this visit took place in October, the cold conditions inside the home and the lack of ventilation was perfect for mold. And you could actually draw lines on the thickness of the mold in the walls and on the ceiling. Like I say, no heating system. And this person did have some small amount of savings, but wasn't unable to spend that money on any improvements on getting water or getting heating because they had mental health problems and a variety of other physical health problems which prevented them from doing so. So it's really a long-term kind of engagement, going back, sitting down with this person, going to his GP, persuading this man to spend some of his small amounts of savings, and we got a grant to be able to get the water back on, to get the heating back on, to start some redecoration, some of the maintenance work that needs to be happening in the house, and to get some support for some of the mental health issues that he was suffering from. This isn't vastly unusual, but it's just an example of some of the level of deprivation that you may encounter. Right, Alan, if you're okay to take over.
Thanks, Simon. Next slide, please. Thank you. Okay, so just have a quick look at what fuel poverty is. So we try not to get too bogged down in its definition, as it is a complex issue. The 10% definition is a general rule of thumb. It's quite often used by energy companies, and it's also fairly straightforward to work out. Governmental definitions now around fuel poverty, so use the low income, high cost model, which kind of focus on the cost side of things, but more recently, it's kind of evolved into a low income, low energy efficiency model, or LILI, which focuses the definition more into the energy efficiency side of things, and it incorporates properties that fall below a band C on an EPC. So that's looking at about 20 million properties, or 2/3 of the overall UK housing stock. So why are fuel poverty and energy usage linked? Well, at 85% of a household's overall energy usage, heating is by far the biggest cost. And it's also the area where the biggest savings can be made. Any overall reduction in the need for heating is a result in terms of saving money and carbon emissions. There's also certain health aspects to consider with fuel poverty. On the more serious end of the scale, you've got the volumes of deaths, which can be attributed to cold and damp conditions. That's nearly 8,500 in 2019-20. And then to put that into perspective, in 2018, there were 1,784 road-related deaths in Great Britain. Next slide, please. So, cold facts. I mean, fuel poverty has a close relationship with ill health, like both physically and mentally. The cold affects the body's physiology, puts extra strain, like specifically on the cardiovascular system. Damp, on the other hand, is more likely to be associated with respiratory conditions such as asthma. It's been found that people with asthma were 2 to 3 times more likely to be living in cold and damp houses than non-asthmatics. The mental toll of fuel poverty is also well documented. Long-term exposure around cold and damp takes a serious mental toll, as well as the other pressures associated. You've got the financial burden of not being able to afford to keep your own home warm, paying bills, etc., can lead to anxiety and depression. and wider societal aspects. You think about pressures on health services, for example. Next slide, please. So the geography matters. This table, it gives a bit of a snapshot into the regions within England. This is the most recent data available. There's usually a 2-year lag between the data set and the publication date. So if you can sort of notice with the proportion of households fuel poor, there is a bit of a north-south divide, but also a northwest-southeast divide. There can be a few reasons in particular that lead to this situation. We firstly need to consider the climate itself. The further north you go, the colder it gets. The further west you go, the wetter it gets, due to prevailing weather coming across the Atlantic. So one way to look at it is that the colder it is outside, the greater the difference is between that and the comfortable indoor temperature. So therefore, you've got greater energy costs required to heat the house. You also need to take into account the type of housing stock that you find in these areas. North and northwest, it's proliferated with old single-skin terrace dwellings. There's lots of back-to-back housing. It's often difficult to insulate and you can suffer more from damp. The financial disparities between regions. You've got the northwest of England, for example, has the highest proportion of people who are in the bottom 10% of earners. You can relate it to health and education. So in 2018, Richmond upon Thames had the highest male life expectancy at birth, the UK at 71.9 years, and there's an 18.6-year difference between that of males in Richmond upon Thames and those in Blackpool, where it's only a 53-year life expectancy. So education is also a factor. Life expectancy and education levels, they go hand in hand. Again, there's more disparities between levels of education, north and the south. So it's kind of like, it's precisely why, for all of these reasons, we try not to get too bogged down in broad definitions of fuel poverty. It is a complex problem, and it's affected by a multitude of external and internal influences. It's not just a cold house. Okay, I think Zach's going to talk about some energy efficiency.
Yep, so this next slide is just about energy efficiency, and it's a really important issue when you're potentially going to be running an energy advice service. So most of the issues we've talked about maybe been social factors or medical needs, but also the property that someone may live in has also a huge factor on whether or not they would be in fuel poverty. So on the right, we see a typical house, uninsulated house. I'm sure you've all seen similar pictures like this before. 25% heat is lost out the roof, 35% walls, 15 the door, 10 window, and 15 through the floorboards. So the lack of insulation can cause high bills, thermal discomfort, and a lot of waste heat being released, escaping the property. People in fuel poverty often live in some of the most poorly insulated homes, and it is key to understand where this heat is being lost. So whether you're on a phone call or whether you're actually in the property might be really helpful. Linking it back to the statement of intent as well and why it's so important. If you do visit someone, they may be eligible for some grants, so increasing the loft insulation, cavity wall insulation. There's even back-to-back external and internal wall insulation funding now. So that's why that statement of intent is so key to find out what's going on in your local area and what people may or may not be eligible for going forward. In terms of poorly insulated homes, if you look on the left of the screen, we can see a screen grab of an energy performance certificate and its rating. We believe this is a really good overall view of what a property may be, how a property may be performing thermally. So this property here has quite a low rating and an F, the potential to go to 73. So the higher it is on this scale, the better it performs thermally and the lower the running costs are for that property. These are government documents. Most properties have one that you can view. This can be viewed before a telephone call or an advice visit, and it gives an indication of understanding the wall type of the property, the loft insulation level, and maybe the associated heating system that may be in that property. So it's a really good starting point and a snapshot for the home you may be going to or the person living there. It doesn't obviously explain social factors, the occupation of how they use the property, but it gives a good overall view. this route might also be a potential funding route. You could be a paid service for performing energy performance certificates, giving retrofit advice, doing retrofit assessments, coordinating on retrofit projects. So that's another route that lots of organisations do go down, maybe an option going forward for some of you. Could we have the next slide, please? This slide is just about the energy costs, and we think it's really important if you're running an advice service, you understand the cost of fuel and the typical domestic consumption values for people you may be visiting. So here are some average costs. There's also different types of meters, such as credit and prepayment. They will have different unit rates and standing charges. It's also an important factor of giving advice. A lot of projects, so ours and maybe yours potentially going forward, will focus on energy switching. It's a really easy thing to report on. It's an actual figure of saving. So it's really key to understand these unit rates at the top of the page and the typical domestic consumption values. Those figures are really important for accurate switches as well. A lot of people tend to just put, I'm a 2-bed property, I live by myself, rather than actually using the data and the figures to get an accurate switch. So improved insulation advice and measures can reduce these bills and bring someone out of fuel poverty. A key example you may come across is someone using electric heaters rather than the gas central heating. The kilowatt hours show how much more expensive this can be, and some simple advice could bring their fuel bill down by hundreds of pounds for that year. If further training or understanding was needed on energy costs and consumption values, the NEA level 3 training is the place to start, definitely. But yeah, I think we're going to have a little break there. If there's any questions, I can see there's something in the chat, and then we'll move on again.
Yeah, thanks, Zach. Dave, did you just have a question for Zach there? You're on mute, Dave.
Yep. So my question was, when would those averages compile, please, for the costs?
So Alan's just put on the chat, they were 2020 figures on a 3-bed semi with 4 occupants.
Good, thank you.
Obviously, we work in Leeds, lots of back-to-back, solid brick, costs will be higher, energy use will be higher. So it's understanding your local environment as well. What's the build type in your area, and factoring that in when giving advice as well.
Yeah, definitely. Thanks, Zach. Does anyone else have any questions for Zach at this point? I can't see any other hands up. So, yeah, should we move on to the next part there, Zach? Brina, if we could just get those slides back up. Cheers.
Okay, so back to me again. So it's just a bit of a visit checklist. The kind of things we look at on a typical energy advice visit. So as a lot of our referrals happen as a result of unaffordable or high bills, it's a useful place to start. You need to be considering like who the supplier might be and what tariff they might be on, and also how they pay. Is it a prepayment meter? Is it credit meter? Are they on economy 7 tariffs? These kinds of things. So there can also be a significant difference between the costs depending on how they're billed, whether it's online billing with a direct debit or compared to something like paper billing. It can be £100 a year more expensive just to receive a bill on paper. The usage, Zach showed earlier, the typical usage statistics, it's an important indicator of how a house is being heated, and also if there may be an issue with the heating system itself. Smart meters are a great tool for raising awareness of usage in the home. They also provide accurate meter readings, which can help eliminate some billing issues, as well as making it easier for customers who may struggle to read the meters. You need to take into account the quality of the dwelling and sort of the state of repair. It can have a significant impact on how the building performs in terms of its thermal efficiency. You need to be aware of any issues of surrounding damp, whether that be rising, penetrating, or most likely behavioural. can investigate any potential leaks, central heating or your mains water leading to high water bills. Again, drafts, windows, doors, pointing, all that kind of thing can lead to a loss of heat from the house. It's also worth going through some appliances with the tenant, with the customer. An old chest freezer, for example, will have significant impact on the property's electric consumption. And so, as we said earlier, using an EPC or some on-site investigation, it can determine how well the property is insulated, whether there might be scope for adding further insulation. They may be eligible for some eco-funding to top up the loft insulation, for example. Next slide, please. It's worth noting the stability of a household's incomes. It can have a significant effect on their ability to pay energy bills. If they're suffering with debt, energy or otherwise, it can all affect your future referrals for that person, whether it is to get some debt advice or maybe into an income maximization service. It will also affect the advice that you need to give, whether that's looking for the right payment method, for example, in terms of metering or what tariff they might need to be on. Health and age is going to affect how the house is heated. Maybe it needs to be warmer than usual due to medical conditions. The advice needs to be tailored to an individual's specific situation and needs. Your social relations in and out of the household, it's again similar to health and age. Household size and demographic will determine energy usage, and the advice will need to be appropriate depending on that situation. Determining if a customer has a support network can be vital, whether that's from a financial point of view, but kind of more importantly on the health side of things, making sure they're okay physically and mentally. Do you need to encourage them to reach out to family for help, or possibly get permission to refer them to an external specialized service? Tenancy relations. So establishing type of tenancy is important. When it comes to resolving any issues that you find at the property, knowing who's responsible for it, and also where to ask for permission if you're going to be installing any further measures. Excuse me. So, for example, insulation, draft proofing, you may need permission. And also, depending on the type of tenancy, may also affect the type of funding that you can get towards certain measures. And then finally, you need to consider the choices the customer is making. So these are the kinds of things that can be affected by some well-delivered advice. And we look to enable behavior changes through education and understanding of how to use the dwelling. And so this can be delivered through some energy advice top tips. Move to the next slide, please. So this kind of information we deliver on a visit when we're looking to help with energy advice. So with regards to the heating system, use the thermostat and set it and leave it at 18 to 21 degrees. That's the World Health Organization's recommended temperature for healthy living. Makes for a comfortable living environment. Sorry, is there a question? Just want to make sure, no, sorry, you set the radiator temperatures, you're setting them to about 55 degrees, but if you've got hot water, set that to 60, and also water storage tank, then that to 60 as well, just to eliminate any issues around Legionnaires. There's no need to be heating the system up to 80 degrees. It's a waste of energy. You want to make sure that the heating system itself is working as efficiently as possible. You bleed the radiators, you check the boiler pressure, water in there, and set any timers as well for when they're in and out of the property. And also if it's an electric only property, so by storage heaters, you want to be setting the input to maximum, charge up overnight on the economy 7 tariff, and then output to minimum, so it doesn't discharge all of its heat through the day, so by the time you get to the evening there's still some warmth left, so negate the need maybe to put on extra heating at that point. So damp, put simply, it can exacerbate heat loss. Wet walls conduct heat out of a property, meaning further heating is then required to bring the property up to a suitable temperature. I think it's one of the main areas where you can make a real difference, just some small modifications to behaviour. The key is just reducing the amount of moisture within the home. We use the acronym HIVE. It's an easy way to remember it. So you're looking to heat the home adequately, insulate it. You want to ventilate properly and also extract any moisture. So from any kind of activities, cooking, drying, bathing, etc. There's some further little tips you can give. Lids on pans when cooking. Don't dry your clothes on the radiators, and close the bathroom door when showering until it's fully ventilated, and then you can carry on. Zach's going to talk about some simple measures.
Yeah, this slide is just going to highlight a way to really add value to any service you may be running in the future. So measures are obviously fairly easy to install, fairly easy to report on, and it's potentially worth looking at for whatever project you run going forward, just to add a little bit of extra value. Like I said, very little training involved as well. We put draft proofing at the top of this list because I think it significantly increases the thermal comfort for the resident you'll be going to see. Reduce energy bills simply as less warm air is escaping out of the property. So some examples of that: letterbox brushes, door draft proofing strips, window draft proofing, chimney balloons, and fill in any holes or gaps that weren't originally in the build. Like I said, very easy to install, especially if they're wooden external doors. Only take 10-15 minutes and can really add some thermal comfort to the property. The radiator panels, another easy one. Reflect heat into the house. Install these on external or adjoining walls, just to push the heat back into the room, rather than it going to the outside wall or window. It's being pushed back into the actual living space. LEDs, again, so easy to install and significant saving for the client. House using LED bulbs, we use less energy per year than one old filament bulb. So it's a really easy thing to do to really add value to that visit you make. Hot water cylinder jacket, maybe slightly more difficult to install, can save 50 to even up to £100 over the course of the year versus that uninsulated jacket. We have got some examples of other measures that we personally fit, but you might want to look into your own measures. You might want to target specific areas of a property. So the measures might be different, but some examples: carbon monoxide detectors, dehumidifiers trying to reduce condensation, and there's lots of water saving products that you could install as well. So yeah, do some research as to what measures might be appropriate for your service or the things you want to be installing. And we have included some hyperlinks of some suppliers. So if you do need a starting point for pricing, for quantity, there's some links there you can have a look at. Next slide, please. Sorry, I've got a question. Should we answer that before we get into this case study? Is that all right, Kai?
Yeah, go for it, Zach. That's fine.
It's just around the setting of water temperature, Zach. So I was just responding, saying if it's running water, the dangers are very, very minimal if it's set below 60 degrees. But in the terms of kind of not wanting to give advice that could be potentially taken in the wrong way, if water or Legionnaires can proliferate when there's stagnant water and it's underneath 60 degrees. So if water is running, you're generally going to be safe, but as a mark of safety, say of 60 degrees. But the advice for 55 I give is for radiators, and I hope nobody's drinking radiator water, because then you're in some serious problems. Okay.
Yeah, thanks, Alan. Yeah, hopefully that answers your question, Tom. We did also have a question from Paul in the chat there. Yeah, no problem that you've joined late. There was a slide up that Alan spoke through before about the percentage of households in fuel poverty, or categorised as that. So we will be sending out the slides afterwards. I think for the Northeast it was around 9.5%. Categorised as being in fuel poverty. So, but yeah, all those stats will be sent out just afterwards. And yeah, there was also a question from Robert on what is a chimney balloon.
So yeah, simply a chimney balloon. If fireplace and open flue is not used in the summertime or even the winter time, you can inflate a small balloon. A little tag comes down, and that just blocks any potential drafts. So that seals that access to open air. Obviously, you can't use the fire and stuff like that, but yeah, that blocks that gap up.
Great, thanks, Zach. Yeah, if there's no more questions for now, do you want to just carry on with that?
Yeah. So Simon's case study a bit earlier was quite a stark example of what you could find. Here's a bit more general idea of what an energy advice service you could get out of a telephone or even a home visit. So this gentleman, he was elderly, vulnerable, cold, and he appeared ashamed of his situation. So that indicates that he might not always have been living in fuel poverty and been suffering with energy vulnerability. There may have been an additional challenge, such as a mental health condition. But on that visit, we performed an energy switch, saving £260 on his energy bills, installed some measures to improve his thermal comfort and also an additional saving. We then referred on to one of our partners to help with his financial situation, Local Citizens Advice. Mr. T also didn't have any cooker or washing machine in his property. Again, there's another hyperlink to a partner where you may be able to access these goods. And also Northern Powergrid had access to a washing machine that we were able to give him. Referring back to the point Simon made about every contact counts, if we'd only been able to contact this client once and install measures, for example, we would have missed out on all these other bits that he was able to get. So doing as much as possible in that first initial contact can really benefit the client you will be helping going forward. Next slide. I've seen there's a question on EPCs. Am I right to answer that at the end?
I would.
Yeah, we can go through some questions at the end, Zach.
Cool. We felt that it was really important to include this slide on challenges. Hopefully you won't come across situations of extreme poverty and deprivation, but at some point you may see this. So the challenges associated with that can be mental health situations, alcohol, substance use, domestic violence, hoarding, online gambling, and some clients, like Simon mentioned earlier, have been suicidal. It's not to say that every single visit will be like this, but it's also not to say that you'll never come across it. So it's just making you aware that you have the right signposting and referral routes before you maybe enter a property. The next point is just managing expectations. Not everything can be instantly fixed. For example, if there was a hoarding issue, that would take precedent over energy advice due to the immediate danger that client may be in. If that challenge was resolved, you can maybe go back to give the energy advice. So it's important to work out what needs to be done in what order. Not everyone may be eligible for your help as well. So that's an important expectation to manage, especially in terms of grants and funding. For example, there might be a multi-generational household. Some generations of that household may be working. There may be a good wage coming in. So they might not be eligible for your service or even some measures going forward. So there's that expectation to manage. And if you are successful in your community group running energy advice service, you may have to focus your support. You could have 3, 4, 5 telephone or home visits each day. So making every contact count and doing as much as you can in that first visit is really important. And finally, just so everyone keeps safe, personal safety, lone worker training, you need robust procedures. Unfortunately, you do never know what is behind that door or on the other end of the line. There may be multiple challenges once you get inside that property. If you're uncomfortable, you need a procedure to either get out of there or to make someone alert that you're not comfortable being there. And finally, your own personal health and well-being. If you go to a few properties where these challenges are present, one after the other, can be really important to maybe debrief with your team, share experiences, just make sure you're talking about your experiences doing energy advice, because there's probably someone in the country that has a similar experience, and I'm sure they'll be more than happy to share that experience with you. Next slide, please. The next steps, this is the whole point of the presentation. We want you to go out, research what you're going to do going forward. So these are the steps we think are really important. Making sure you know what's in your area, planning your project. If there's any funding available, do you need funding? what funding streams might be available from DNOs. Simon went through them earlier, so it's really important to check out what you might be eligible for. Training, can you further your own knowledge? Can you improve your team's knowledge? Can you take that energy advice service to the next step, doing EPCs, retrofit, that debt advice? So that's an option. Partnerships, no matter how big or how small, from the DNOs right down to other local communities, organisations, they're all really important, and there would need to be some form of agreement maybe before you started attending homes or calling people, in case you do come across one of those challenges. Engagement, again, Simon mentioned earlier, if there's issues with seasonal conditions, if you don't have the work coming in, how will you continue that engagement going forward? And experience, hopefully some of you may have had experience in the past of delivering similar schemes, but if not, I think these are the steps to start with to deliver some energy advice. And I think that's it in terms of our presentation.
Great, thanks very much, Zach, and to Alan and Simon as well. And yeah, really good to on that point, thinking about next steps. It's definitely something we want to pick up on in our breakout sessions shortly as well. Zach, we did just have one question from Nick, I think, just asking about EPCs. Can we have confidence in how they're procured, basically, and how they're produced?
So generally, you would hope everyone keeps up to date with training and things like that, but you can't 100% guarantee it, I'm afraid. We do come across rogue EPCs where things don't make sense. But like I mentioned earlier, I think the EPC should be used as an initial guidance. So some people in this chat might not know what wall type it is or what heating system it is. So it can be a really good starting point if it's a correct EPC. But if there's been issues, the assessor isn't great, for example, then it might not always be 100% accurate. I will say there is audits on EPCs, and usually rogue assessors do get caught out eventually. Yeah, hopefully it's accurate, but not always.
Great, thanks, Zach. Yeah, hopefully that answers your question on that one, Nick. Did anyone else have any questions for Zach, Simon, or Alan? You will get a chance in the breakout sessions as well. But yeah, I'm just conscious that we've promised everyone a tea break, and yeah, we're quite keen for everyone to just have a chance to get a quick refreshment. A little bit of time away from the screen. And yeah, so we'll just have a quick break now for just 10 minutes before we go into our breakout sessions, where we're quite keen to get feedback from you guys and get you thinking about what you're going to do in terms of next steps, as well as give you the chance to ask any questions to the experts we've got. So yeah, we'll go for a break now, and if I could ask everyone to just be back sharply for 3:45, please. Thanks.
Cheers, guys.